Ultra-hydration method for management of Macro-Straie. This method was invented by our Egyptian team in cases of Macro-Straie. So first we have to mark the flap in order to return it in place once it's elevated, then separating the flap edge by Sinskey hook, and after marking the Sinskey hook, we can pass the elevator under the flap, and this case was an SBK case, so the hinge is on the nasal side. Then here is the Macro-Straie, which can be ironed with two dry micro sponges. Then from the back side of the flap, after complete stretching of the Macro-Straie from the inner side, you have to be sure and take your time to try to unfold it. As you see here, the Macro-Straie are very well seen. What's new here is to apply distilled water on the back of the flap. This distilled water will make edema in the flap, and this distilled water will allow this flap to be contracted and rolled on itself. Here's the distilled water, and as you see, this rolling of the flap will help to stretch the Macro-Straie and will disappear totally from the inner and outer side. This rolling of the flap edges is what's needed in order to stretch the Macro-Straie. After cleaning from the bedside, you can return the rolled flap and then unfold it easily and smoothly and slowly, and then to apply your BSS under the flap and over the flap without removal of the epithelium, and apply your contact lens for 3 days. Follow up with the patient. Very important to notice, once the patient is on slit lamp, immediately after the Macro-Straie to be unfolded, you will see some Macro-Straie still present, which will disappear within a few days. Put the contact lens, the usual post-operative regimen of antibiotics and steroids. Thank you so much.